Hi, in this video we'd like to discuss the topic of cervical insufficiency or cervical incompetence. So this condition is an entirely diagnosable and preventable cause, a primary cause for late miscarriage and also recurrent late miscarriage. So for patients who have a history of miscarriages happening after week 12, specifically second trimester, third trimester, and if you have a history of 2 or more late pregnancy losses such as these, very similar, happening in the same period of second trimester, third trimester, very likely it is caused by cervical insufficiency. Cervical insufficiency simply means that the cervical muscle, the cervical tissue is prematurely dilating because either it's experiencing some weakness in the tissue or some other cause that's causing the cervix to dilate prematurely. So cervical insufficiency, besides being the primary cause for late miscarriage, it is also primary cause for premature birth in a lot of women because the cervix has dilated far earlier than it was supposed to be during labor. So let's say a healthy cervix usually dilates towards the end of the third trimester, but patients with cervical insufficiency with a ranging of severity, they will experience this dilation in the second trimester, early third trimester, when the baby is not even fully formed. This can cause either a pregnancy loss or a premature baby that needs a lot of postpartum assistance to assist and also maintain the baby's survival. So although we do have techniques and the technologies to preserve this premature baby, here at Antai Hospital we do want to prevent it entirely from happening and ensure you have a smooth pregnancy till full term. So when you go for a checkup before pregnancy, usually your doctor will not do a cervical insufficiency test because it's quite rare. You will need to request from your doctor, especially if you know you have a history. Here at Antai Hospital, however, we conduct it as standard procedure because we do specialize in miscarriage prevention and treatment. And usually diagnosis of cervical insufficiency is done using transvaginal ultrasound and also 4D color Doppler ultrasound. And then we can measure the cervix and also look at the tissues surrounding the cervix. Then we can accurately diagnose cervical insufficiency, and usually we also look at your medical history. So once diagnosed, treatment here at Antai Hospital is far different than the common approach. So many doctors will use a treatment procedure known as a cervical cerclage, where they use sutures, stitches to stitch the cervix to prevent it from opening like a bag where they can zip it. That's how they do it, and although this can yield some effectiveness, usually it will cause some infection, some massive internal bleeding. The entire procedure isn't entirely safe and really depends on the doctor's expertise and experience. Here at Antai Hospital, we use a cerclage, but it's made of a biomaterial that is safe and non-reactive to human tissue, and there's no stitching involved at all. So this can prevent any occurrence of infection and also prevention of any internal bleeding. So there will be no hemorrhage, and the entire procedure is done using a minimally invasive 3D laparoscopic procedure. Our doctors have over 20 years of experience, and usually these types of procedures have a success rate of up to 95%. It is unlikely you will experience any complications anymore after this Antai Ring cervical cerclage treatment. Remember, we don't use any stitching for the benefit of the patient, for the prevention of complications, and it's done using minimally invasive 3D laparoscopic surgery, so there's no scarring post-surgery, and also there won't be any trans-abdominal surgery as well. The entire procedure can be done within an hour or two, and patient is quickly allowed to go home to recover. And this patient will unlikely experience any complication. And this treatment here at Antai Hospital comes with a full contractual treatment. And so if patient still experiences any pregnancy loss after receiving our treatment, then we are obligated to return the full refund, the full treatment cost to the patient. So get in touch with us via the website, learn more about cervical insufficiency, especially those of you who have a history. Schedule an online consultation, discuss with us your needs and also how we can help you ensure a healthy pregnancy in your next pregnancy journey.